So good day. I'm Michael Atkins. I'm the Deputy Director of the Georgetown Lombardi Comprehensive Cancer Center in Washington, D.C., and a longtime expert in melanoma care and melanoma clinical research. And I'm on the board of directors of the Melanoma Research Foundation. And I'm here with Doug Brodman, who's going to introduce himself, and we're going to talk about clinical trials in melanoma and particularly his experience.
Great. Good morning, Mike. Yeah, I'm Doug Brodman. I'm actually a stage 4 metastatic melanoma survivor for 7.5 years now. And I am on the board of directors of the Melanoma Research Foundation. So I'm very happy to be able to give back and help us find a solution for this rather terrible disease. So I'm looking forward to the conversation, Mike.
Great. Me too. So, Doug, you had stage 4 melanoma, it sounds like in 2014 or 2015 or so. That was a time which very active in melanoma clinical research. Why did you decide to take part in a clinical trial for your melanoma? What was your thinking at that time?
Sure, Mike. Yeah, my journey with melanoma actually began with a diagnosis of spindle cell melanoma on my scalp. And I had to go down the path of surgery and continued on with a course of radiation. And unfortunately, at the end of that month-long treatment of radiation, a tumor popped out again on my scalp. And I had my traditional PET scan done, and it was found that I had the disease had metastasized to stage 4 in lung and livers. So my team at Sloan at the time, we talked through some possible next steps and options, and obviously I eliminated some options with surgery and radiation. So the recommendation was to pursue a clinical trial that best fit my phase of melanoma that I was experiencing. So they sought out a trial at Moffitt in Tampa, since there was none available in Sloan, and from there, it took me about 2 months to get enrolled in the process of the clinical trial. But the underlying reason for me taking this, what I thought was a logical next step to find a solution and hopefully manage and eliminate the metastatic stage I was experiencing, is that there were fewer options at that time, believe it or not, and that was only 8 years ago. So, and the experience to date with immunotherapy was showing great promise. And as it turned out, I was an ideal candidate having moved to stage 4. So that's the reason I took that step into a clinical trial.
Yeah, well, that was an exciting time where we were developing new immunotherapies, but we weren't sure how well they would work, and particularly weren't sure how they would work in a spindle cell type of melanoma. And as it turns out, not only do we learn that they work in melanomas, these type of immunotherapies, but they work particularly well in spindle cell type of melanoma, which is part of the reason we're having this, you're here to have this conversation today.